When the British Medical Journal, BMJ, talks about influenza, the picture it paints is fairly clear. Flu is not just a bad cold. It has a pattern, and it tends to hit hard and fast. Here are the key signs and symptoms of flu, described in line with BMJ's clinical descriptions. Sudden onset of fever. This is one of the strongest clues. The fever usually appears quickly, often above 38 degrees. Patients often describe feeling fine one moment, then unwell a few hours later. Severe fatigue and weakness. BMJ notes that flu causes marked exhaustion, not mild tiredness. Real fatigue that can keep someone in bed for days. Headache. Often intense and persistent. It commonly affects the forehead or behind the eyes. Muscle aches and joint pain. This is a classic flu feature. Generalized muscle pain, especially in the back, legs, and arms, is very common and helps distinguish flu from a common cold. Dry cough, usually non-productive at first. It can become persistent and may linger even after other symptoms improve. Sore throat, often present early, though usually less prominent than in common colds. Chills and sweating. Patients may alternate between feeling cold and excessively warm as the fever fluctuates. Loss of appetite. BMJ highlights reduced appetite as a frequent symptom, alongside a general feeling of malaise. Nasal symptoms. Runny or blocked nose can occur, but they are typically less dominant than in colds. Gastrointestinal symptoms, more common in children. Nausea, vomiting, or diarrhea may occur, particularly in younger patients. Overall, BMJ describes flu as a systemic illness, meaning it affects the whole body, not just the nose and throat. That whole body impact is often what makes people stop and say, "This feels different."